Afternoon, everyone. We're just past 12:30. Good afternoon. Welcome to this month's Lunch and Learn session for the London Centre for Work and Health. I'm delighted to introduce Robert McNay from Barts Health NHS Trust here in London. Robert's going to present some results from a scoping review project that he and our study team have been leading on uh, in the last 12 months. So this is a timely opportunity to share the results from a recent projects that's now being wrapped up. So I'll just ask everyone to please put yourselves on mute. As a reminder, this session will be recorded and we plan to make this available publicly on our website, but we'll be stripping out faces and names. So it's just the slides and Robbie presenting. So if we hold questions until the end, please feel free to use the chat box and we'll open it up for discussion at the end of the session. So I'll hand over to you now, Robbie.
Yeah, sure. Sounds good. Hello, everyone. I'm Robbie. I'm one of the research physios that works at Barts Health, NHS Trust. Just a little bit of background about me is that I'm essentially a rotational physiotherapist that is from a mostly clinical background. And I have been fortunate enough to have one of my rotations in research. Essentially, it's a trauma and orthopedic research rotation, of which I have been essentially the guinea pig. It's not been done before, and it's kind of testing a collaborative relationship between cross sites, basically, because I'm mostly based at one site, and they wanted to um, experiment with having a position like mine and kind of do research across the different sites as part of Barts Health Trust. So it's my first time kind of doing anything really research related is being involved in the scoping review, apart from, of course, research that I did at university. But this has kind of felt like the first thing doing as a proper adult, let's say. But I've enjoyed it. I've really enjoyed it, actually. I think it's a scoping review has been a nice introduction into research and kind of thinking thinking of it as almost like a stepping stone in a way about how it opens up questions and possibly provides some answers, but allows for more critical thinking about the same topic, but in a kind of wider and deeper perspective. So I have enjoyed it a lot. But yes, so today I will be talking about the scoping review that we've been doing, which is looking at work participation interventions in people with physical long-term conditions. So I'm going to begin. So just as a kind of introduction is the scoping review has been led by authors from various different affiliations. So, for example, Guy's and St Thomas's, Barts Health, King's College London, KCL, National Heart and Lung Institute, Imperial College London, Royal Brompton Hospital, and QMUL. So it's been a pretty nice thing to do, really, because we've had all kinds of different members of staff from different areas. So it's been nice having that relationship with everyone and some cross site working. So just a little bit about kind of background and context. So around 30% of working age people in the UK, so 11.9 million, live with a physical long-term health condition or PLTC. Now, this is defined as a disease or condition for which there is currently no cure. 1 in 4 UK employees reported having a PLTC, and people with one health condition have an employment rate of 61%. Research shows that having one or more PLTCs increases the risk of unemployment, including health-related job loss. And patients with PLTCs consider improving their work participation to be an important outcome. Despite its importance to patients, work participation support is an unmet care need, thereby massively affecting quality of life. And there is a need for integrated and collaborative interventions to support work participation for patients with physical long-term conditions. So that's the kind of reason why we were doing this scoping review in the first place, is because it's exploring scoping out the literature around this very important topic, which affects very, very many people. So just kind of expanding on that a little bit more is the scoping review is developed as part of a larger program of research to explore the current body of evidence for work participation support for adults with one of 4 physical long-term conditions. And those 4 are sickle cell disorder, or SCD, cystic fibrosis, or CF, severe asthma, or SA, and inflammatory bowel disease, or IBD. And the reason why they were chosen is because they affect different demographic groups and primary organ systems, and they have different timing of onset and are all amenable, to treatment with NDMDs, or novel disease-modifying drugs, which have led to dramatic improvements in health outcomes for some physical long-term conditions. So this is kind of having a look at the literature, scoping out the literature, and seeing if there is potentially a gap in the research in relation to both work participation interventions and outcomes. So just to kind of explain a little bit about the conditions, I'm sure people probably know about them anyway, but just a little bit more kind of context is sickle cell disorder is a genetic disease affecting the structure of hemoglobin, leading to repeated hypoxic crises, which can cause various different symptoms like chronic pain, stroke, avascular necrosis. And around 17,000 people live with SCD in England. And it mostly affects people from Black, African, or Caribbean backgrounds. Cystic fibrosis is a recessive disease resulting in a mutation in the cystic fibrosis transmembrane conductance gene, and causes development of things like bronchiectasis and pancreatic insufficiency, and it mostly affects the Caucasian population. In terms of severe asthma is essentially uncontrolled asthma. So 4 million people in the UK have asthma, but severe asthma is uncontrolled asthma, wherein individuals need a high dose inhaled corticosteroids plus a second controller, which prevents it from being uncontrolled. And IBD, or irritable bowel disease, is an umbrella term, which is an autoimmune disease causing inflammation in the GI tract, and it covers both ulcerative colitis and Crohn's disease. So IBD is the umbrella term that covers that. So just to kind of summarize the introduction, or the kind of context and background to the scoping review, the 4 physical long-term conditions that we looked at were sickle cell disorder, cystic fibrosis, severe asthma, and inflammatory bowel disease. I think I said irritable, I think I meant inflammatory. And that's and then the objectives of the review were to identify interventions aimed at improving work participation, including rationale, context, and timing, and explore the reported interventions' effectiveness. So just a little bit about methodology and literature search. So the review was designed and reported in accordance with the PRISMA scoping review extension, and the protocol was pre-published with the Open Science Framework. So search strategies, eligibility criteria, and data extraction forms were developed by all of the authors and pre-piloted prior to the review. So we had extensive discussions about key search terms, search strategies, and eligibility. And of course, before doing the conducting the search, it was all kind of made sure that we were all on the same page. So there were 4 authors who conducted the literature search terms over a span of 1 month last year, and each of the authors were essentially assigned one of the physical long-term conditions. So I was given sickle cell disorder. Literature was then broken down into full text database screening and grey literature, and 2 reviewers independently screened for inclusion and completed data extraction. What I mean by this is that once we conducted the search, another reviewer would just cross-check and make sure that everything was okay. So, for example, after I did sickle cell disorder, Josh, who did inflammatory bowel disease, we looked over each other's searches and just made sure that everything was above board and okay. So these are the scientific databases that we looked at. So we looked at Medline, EBMR, CINAHL, MBase, British Nursing Index, ASCIO, Scopus, and Web of Science. And grey literature sources were from things like charity websites, Google Advanced Search, and Remploy and ACAS as an example. I'm just going to briefly touch on the inclusion and exclusion criteria, excuse me. So we involved, it was adults only, or what we included were adults were over the age of 16. They must have had one of the four physical long-term conditions. We excluded anyone below 16, or if they didn't have one of the physical long-term conditions. The outcomes of the literature must have been related to work and work participation. And if there wasn't anything reported on work-related outcome or information, then we excluded it. And we only included literature where there was quantitative or qualitative data, systematic reviews, or other literature reviews, and any kind of organizational reports, but we excluded blog pieces, social media, personal commentary, opinion pieces, editorials, and any kind of abstracts. So we only included full text papers. As well as that, we only looked at literature that was from 2003 onwards, and we excluded anything before rather 2003. And this is because of the introduction of biologics or NDMDs for severe asthma that was introduced around 2003. So we didn't include anything before that because of how that kind of affects work participation, essentially. Right. So then after conducting the search, we imported all of the full text literature that we got from the scientific databases into Rayan, which helped us to remove duplicates using an automated function, but then we cross-checked everything as well. And for the grey literature, it was the first 50 results from each of the public website searches, which we downloaded and screened for duplicates. And then we conducted our search using title and abstract for database searches, but grey literature was just the title and any kind of available summary content. We didn't need any kind of ethical approval for the review, and any kind of discrepancies or inconsistencies, we reached out to our supervisors to just check and make sure that everything was okay with that. So this is the most recent and up-to-date Prisma diagram, which we've gone over quite a few times just to make sure that everything's okay. But essentially, over 48,000 pieces of literature were scoped out to see if they were relevant. So there was quite a lot of digging through, essentially, and out of all of those data, there were 8 studies that we included in the review. So really minimal compared to all of the literature that we managed to get in the first place. And as you can see from the bottom, the only 8 that we included, of the 8 that we included, 0 were from sickle cell disorder, only 1 was from inflammatory bowel disease, 3 were from cystic fibrosis, and 4 were from severe asthma. So for the data that we didn't include, we broke down into things like if it was abstract only commentary, no relevant work information if there were duplicates, another diagnosis which didn't pertain to the 4 physical long-term conditions, and if they were below the age of 16, for example. And in terms of not English language, we tried our best to find data or literature that was translated, but often that wasn't available, so we excluded that. And then out of the key results, so in terms of the key results, so obviously it's very important to kind of look at the 2 numbers, really. I mean, we had 48,000 pieces of literature that we sifted through, and only 8 were included, and as they were seen as being eligible, and there was no appropriate data for sickle cell disorder. And of the 8, as I said before, 7 were on cystic fibrosis and severe asthma, and only 1 was on IBD. So interventions were categorized as work adaptation, counseling and coaching, screening for social needs, and pharmacological treatment. So just in terms of severe asthma, so I'm just going to briefly touch on the results, but severe asthma, all of them were to do with pharmacological intervention, so NDMDs. And so it did report that there was some kind of improvement when we had a look at the work outcomes. So in terms of outcome measures like work and participation index, or WPAI. So there was improvement. So for example, DRIC 2023 looked at median missed days at work improved, and negative impact of asthma at work decreased from 70% to 26% when looking at the introduction of NDMDs. And there was work impairment, which was decreased by 7.9% with an NDMD. And again, with Alba's study as well in 2021, with a decrease in work impairment. And in terms of Niven, those unemployed gained employment, and 8.7% of the employed became unemployed. So it's a big improvement that those unemployed gain employment. But the important thing to note is that with severe asthma, as I said before, it was really mostly a focus on the introduction of NDMD. So there wasn't anything outside of that. So it was purely a pharmacological intervention. In terms of cystic fibrosis, so there were 3 studies that were included. One was looking at a screening tool for social needs across 8 domains, and 56 were screened as being positive for social needs, but it doesn't really provide a lot of information, and that was the intervention itself was the screening tool. So the thing about that study is it didn't really kind of go into how effective the screening tool is and what it really kind of means for the future for those individuals with cystic fibrosis. With Williams 2012, it looked at certified rehab counsellors, so CRCs, which have been seen to help individuals with cystic fibrosis manage health challenges while achieving employment and a fulfilling life. Employment guidance from rehabilitation counsellors focused on exploring career options, minimising exposure to things like respiratory infections, providing relevant training, and providing access to benefits. But I think it was quite a small scale study, so it wasn't particularly generalisable. And Zupanich provided guidelines for career counselling and professional requalification, which recommended to embed employment advisors within a healthcare team, avoid specific occupational exposures, focus on educational attainment, and provide flexible working patterns and self-employment. But that study didn't really assess how effective the guidelines were. And again, I believe that was quite a small scale study as well. And lastly, the study on inflammatory bowel disease. So Cohn in 2018 provided flexible working conditions and teleworking. At 6 months, 9 out of 14 had no sick leave, and the majority were happy with their work adaptations. But as you can see, only 14 participants in the study, very small scale study. So it's not particularly generalizable to the wider population of those with inflammatory bowel disease. And employers viewed the project as a positive experience for both parties and highlighted the importance of a trusting relationship between employer and employee. And 86% were satisfied with their work adaptation. So it is showing that there is a role in terms of providing work adaptations and looking at work participation in individuals with physical long-term conditions. But as I said, it's only 14 participants, so it's not very generalizable at all. And just in terms of talking about the key results here, so severe asthma had the most promising results, showing an overall reduction in sick days and an increase in work participation and employment. However, it was really only focusing on NDMDs only and didn't focus on other things that might be quite important, like guidelines, recommendations that might be non-pharmacological based, for example, and what effect that might have on work participation and employment and job satisfaction and overall quality of life. In the single identified inflammatory bowel disease study, more than half of the patients showed no absenteeism during the 6-month follow-up. But again, it was a very small scale study, so it was only 14 participants in that one study. So just kind of looking at things from a wider perspective. So despite generating over 48,000 results after deduplication, the search revealed that very little of the existing research for these 4 conditions included targeted work participation intervention or reported work-related outcomes for any management strategy. And the data that we did get was with severe asthma, NDMDs only. They were all small-scale studies, The interventions and guidelines weren't really assessed and to see how effective they were. And there wasn't really a lot of mention on cost effectiveness, which is all very important things to have. So in terms of limitations, so the search term work will have been the main reason why we had so many excessive hits when we did our search. But we tried to mitigate that with including other search terms such as employment and occupation, which we hope omitted irrelevant studies. The studies were included from high income countries in Europe and North America, and there wasn't really a lot of data that we were able to pull from low or middle income countries in other parts of the world, like South America, Africa, and Australasia, which highlights a lack of diversity in the literature that we did manage to get. And not all of I've put the studies included were conducted, not all of them were, but most of the data that we got was pre-pandemic, and the kind of nature of the workplace has changed since the pandemic. So it would be good to have more kind of up-to-date and relevant data that we could kind of have a look at how that might affect a work participation and interventions. And many of the studies on severe asthma are funded by large pharmaceutical companies, which massively increases the risk of bias. And there was no studies included specific information on participant occupational or contextual factors such as sick pay, healthcare access, or workplace accommodation. So there was a lot of information that we were looking for that we didn't really get, and would be very useful to have in future research. So in terms of generalizability, I did touch on this before, is that they originated from Europe and the US, primarily focusing on high income settings, with a notable absence of publications from middle and low income countries. And interventions developed in high income contexts may not be directly applicable to lower income regions because of variations in healthcare infrastructure, cultural attitudes towards work, and the variability of occupational health services and workplace accommodation. So just to kind of summarize and think about the next steps, is this scoping review definitely highlights a gap in the literature, because we didn't really get a lot of literature, and what we did get was not necessarily the best, due to bias and small scale studies and providing guidelines but not necessarily assessing them. And given the fact that I spoke about before about the importance that individuals find work to be in their lives, given their physical long-term conditions, it definitely opens up the need for further research. For example, clinical trials or randomized control trials around workplace interventions for physical long-term conditions, such as, all four of them is going to be necessary, but given the fact that sickle cell disorder, we couldn't find really any relevant literature at all. What we did find in the grey literature was relevant, but it was a opinion piece or a blog, and so it wasn't included. And the guidelines that were offered, there wasn't really any kind of foundation of reason behind them. So it would be good to have more workplace participation interventions tried and tested and researched first. So the scoping review definitely feeds into the larger program of work funded by the NIHR, which may lead to something like a clinical trial, which I believe after doing the scoping review would definitely be appropriate. And it highlights the need for effective strategies aimed at improving workplace participation and overall quality of life for people living with these conditions. And that may inform, provide kind of this scoping review might provide the foundation for future research, which may be instrumental in informing stakeholders, employers, policymakers, and the importance of developing a support system to enhance work participation with these employees with physical long-term conditions. And hopefully the scoping review can underscore the need to develop and implement these strategies aiming at workplace participation. So so that's it really. And just giving thanks to everyone. So these were so we had Chi, Josh, and Imogen, who were doing the literature search with myself. and then Lisa and Joe giving supervision where appropriate, and of course Vaughan as well helping out. So thank you very much.